Hello, my name is Joan Rudder-Ward, the host and producer of Silver Sage, a program featuring people 50 and over who are living their lives to the fullest. Our goal is to encourage you to live your life and forget your age. Besides, how old would you be if you didn't know how old you were? Today we talked to Dr. Leita Harris on the subject of menopause, what the symptoms are, some of the remedies, and how family members can be a support to a woman at this time in her life. Hello, thank you for joining us today at Silver Sage. And our guest today is Dr. Leita Harris of Nurturing You Women's Health and Wellness. And today we're going to talk about that topic that sometimes we don't want to talk about, but we have to deal with women going through transition. And it's the topic of menopause. And men, don't leave, because we're going to also give some information that will help you understand more what women are going through. And if you have a wife, girlfriend, a sister, someone going through menopause, how you can be a support to them. So thank you for joining us today, Dr. Harris.
Thank you.
Okay, and we're talking about menopause, and you being a gynecologist and a woman's wellness doctor. This is something that I know you deal with quite a bit.
Oh yes.
Okay, so just I know most people will probably understand. They already know what it is, but can you? But still, I'm going to ask you, what is menopause?
Okay. Well, it's basically a time where a woman's ovaries stops producing the hormones that it normally was producing during the reproductive years. So there's several different hormones that women produce during their reproductive years. It's not just estrogen, it's not just progesterone. Women also produce testosterone as well, although that's been thought to be only a male hormone. Women produce testosterone as well. So menopause is the cessation or the stoppage, pause, of their period, menses. So when the menses stop, that's pretty much what designates. But as you realize that there's some women who have had hysterectomies where they have their uterus removed, and so they're not having any periods, right? But they still have their ovaries producing the hormones until it normally would, till they ordinarily would go through menopause, or when the ovaries stop producing the hormones that it normally was doing. So it's defined as cessation of periods, but in someone who may not be having periods for other reasons, it really is better classified as when the ovaries stops producing the hormones that it normally was producing during the reproductive years.
Oh, okay. So many of us have heard these horror stories about women going through menopause, or knowing people going through it and having a hard time. But then there are people that don't, they don't have all these hot flashes and whatever what other symptoms of menopause. And so why is that? Or
well, I mean, everyone's individual. That's probably the simplest way of stating the answer to that question. But just the same way as everybody may kind of handle different types of medical conditions differently. Women go through menopause differently. So as you said, there's some women that rarely have or barely have much in the way of any symptoms whatsoever, and there's others that have the extreme. And in fact, I think one of the things that's thank goodness most recently came out in some studies is that even women over 65, 70 years old can still have symptoms related to menopause if they're not on any type of replacement that's keeping that under control. So it's not one of those things where, okay, just hang in there, for 2 or 3 years and you'll be fine. Not everyone fits that pattern. So there are some women that have very minimum symptoms and go through just fine. There's others that may have some symptoms for a few years, and then they're fine. There's others that never stop having symptoms. And
Really?
of course, yeah, there's some that just they're waiting and they're waiting and they're waiting and they're trying to see if they're able to just kind of wait it out, so to speak, and here it is 10 years later, and they are still having symptoms. There's women that take even hormones and still continue to have some symptoms. So it really is a matter of, I look at it as whether you choose to have hormone replacement or not, really just depends on, of course, your medical risk factors, your family risk factors, and then how much do you think you can handle? How much do you feel that you can tolerate? But one of the things I like to tell people is you don't have to suffer.
Right.
You don't have, there are things that can be done, things that can be used to help to minimize some of the symptoms that are having you just, like you say, go crazy or whatever, however you put it. And I think hot flashes is probably the biggest thing that people, you know, like, oh, hot flashes and night sweats, but there's so many other things that go into the equation. So,
really?
Yes.
Well, can you tell us, like, what are some other symptoms? Okay, yes, we know about the hot
Right,
flashes,
right.
the night sweats.
Right.
Sometimes there's, let's see, what is it?
Memory loss.
Memory loss. Okay.
Memory loss, yes. Foggy brain, you know, poor concentration. There's physical things, you know, the skin dries, loses elasticity as well. There's some people that have a lot of emotional changes like anxiety or even depression type symptoms that start to kick in as well. Insomnia, that's another thing, real difficult sleeping, even if it's not related to night sweats, because of course you think about, okay, night sweats, it wakes you up in the middle of the night and you know you're tossing the sheets off and then you're cold and you're putting it back on and then you get hot and you toss it off, and so that's in and of itself can cause you to, you know, be wakeful and not be able to sleep well.
Right.
But you also have problems with difficulty falling asleep, and then which is different from a difficulty staying asleep as well. And then even just thinking about the vaginal tissue, you know, people don't want to talk about this, but the vaginal tissue thins out, becomes atrophic. So the lining becomes very thin, it loses elasticity, it loses thickness, it loses the folds that's there, it loses the ability to have secretions, and so lubrication. That's why a lot of women complain of vaginal dryness, you know, as their hormones are starting to change. You know, some women, if they're not sexually active or have had, say, a C-section, never delivered vaginally, sometimes it's very painful, you know, to have intercourse because the vaginal tissue doesn't stretch as well, or it narrows down, and then again, like I said, lubrication problems as well. So that's another thing. Bladder problems, okay, because if you, I mean, a simple way of saying it is the bladder is kind of the roof or the top of the vagina, towards the top, and so because of that thinning that takes place, many women start to have problems with urinary urgency, like feeling they have to go to the bathroom frequently, or they become more susceptible to urinary tract infections as well. Or frequency, going to the bathroom frequently. So these are all related to that atrophy or the thinning that takes place in the vaginal tissue. So, yeah. And of course the bones can start to thin out, and the cardiac, the lipid profile changes. So yeah, a lot of things. Wow. A lot of things.
Okay, when you talk about the lipid profile changing, what kind of changes? Is it going to make you, well, what kind of changes do you see there where you have, like, does it elevate your cholesterol readings?
Right, exactly.
Really?
Cholesterol can go up, you know, the bad cholesterol goes up, and then the blood vessels can lose the elasticity as well. And so that's one of the reasons why women that are postmenopausal, if they are depleted with estrogen and are not taking any replacement, do increase their risk of having problems with their heart. You know, like heart attack risk goes up postmenopausally as well. So those medical things, you know, start to take place as well. So yes.
Oh,
yes.
interesting.
Hair loss. I mean, I
Hair
could
loss.
go on. I mean, there's a lot of other things. Lack of libido, decreased, you know, sex drive. All of those things play in. So yes.
Okay.
Low energy.
Low energy. Okay.
Yeah.
All right. It kind of sounds like women get a bad deal once they start, you know.
Right. There's a lot of changes.
Yeah, going through those transitions.
Yes,
It doesn't sound fair. So
yes, ma'am. There's a lot of changes.
Wow.
Yeah.
Okay. Well, what is perimenopause? Is that like before, or what is that?
Well, the term, well, actually, it's like perimenopause.
Okay.
Is kind of like a term that was coined. It probably is more accurately stated as premenopausal. Basically, it's that time where hormones are changing, and there may be some symptoms that are developing, but they haven't quite gotten to the point where they're now postmenopausal, where everything is stopped altogether.
Okay.
So many times there's menstrual cycle changes where you know, you may skip your period for a month. You know, you may skip. You may have cycles too soon. You may have it too long. You may have it heavy. You may have it light. You know, and every combination of that. So menstrual cycle can start to change, and you know, for some women, they may still even be having monthly cycles and are starting to have hot flashes and night sweats. So the hormones are changing, and their body is responding to that change, but they haven't quite gotten to the point where everything is depleted for a long stretch of time, and they're no longer having cycles, or everything is now totally low, like I said, in case if they're not having menstrual cycles.
Okay. Okay, so someone who hasn't started going through menopause yet, I mean, there could be this big fear, right? Because all these things that, oh my gosh, I don't want to be having hot sweats. I don't want to be crazy. I don't want to be, you know, I mean, it just sounds awful.
Yeah.
So how can someone even prepare themselves for that?
Part of it, of course, is education, you know, because as like even doing something like this, informing women, letting them know, because if the more informed you are, the more you're able to kind of understand, because sometimes lack of understanding is what gets people very, very full of fear and concern, and you know, but if you know that it's part of the process, then you can be more clear-minded about what do I need to do about this, or what can I do. And it has been shown that women kind of transition through a little bit easier if they have very healthy diets and they're very physically active. I mean, yeah, so those are definitely things that do make a difference. So, so you can ease your transition, if you will, if you are just keeping yourself healthy. You know, like I said, with your diet and your exercise and things like that. So, and then there's, you know, when it comes to the hot flashes and sweats and things like that, there are triggers. There are certain things that trigger hot flashes and night sweats.
Oh, really?
So if you are, you know, for some people it's caffeine, some alcohol. So you drink a glass of wine and all of a sudden you're, you know, that's spicy foods can do the same thing. Hot environments can do it. And even just being in a state where you might be a little bit more nervous or anxious. You know, say you're standing in front of a board and you have to do a presentation. You know, so of course that just, you know, you're already anxious, you know, or nervous, and so that can trigger hot flashes. That's why I really feel so sorry for, you know, some women and some of my patients where they may be, say, executives or people that have to do presentations, and so they're already getting nervous. They have to make a presentation, and here comes the darn hot flashes, you know, getting on top of that. So they're dripping wet, fanning themselves, you know, they're beet red, and, you know, God forbid if they're in a room full of men and they're standing there, you know, going through this whole state of anxiety and feeling very embarrassed and nervous, you know. So, so understanding that these things can happen, like I said, is part of solving it, and then or being prepared, knowing. I can't believe how many times women don't even understand what's going on with the vaginal tissue. I mean, just that alone, they don't understand. I've had people that, like say, they got remarried in their 60s, you know, maybe, you know, and even if they did have children, but certainly if they didn't, and certainly if they had C-sections, and now they're married and they're trying to become sexually active, and they realize that it's not happening. You can't fit, if I can put it that way. So they have to, you know, it's kind of like, okay, it's not hopeless. You know, I have to really console them and say, this is not hopeless. We can help you. We can do something for you. It's not this hopeless state where it's impossible for this to happen for you. Intimacy is important, and it's not impossible that we can, you know, do something to help you. So, but knowing ahead of time that this may be the case will help to offset
some of these worries.
Yes, the worries, exactly.
And it seems like it's really important too to really know your own body.
Absolutely.
As far as what the triggers and things are, is to pay attention to these things. Oh, when I eat this, I notice I get a hot flash type thing. So you know to you know, avoid that, especially if you don't want to have it at that particular time. Yeah.
You know, and you know, self-awareness is very important. And you know, layering your clothing, like you said, being prepared. I mean, layering your clothing. You have to know what kind of materials. There's certain kind of materials even that kind of trigger hot flashes, just because they don't allow for
the skin to breathe and things like that.
And so that can trigger it as well. So you have to understand, like you said, even materials, clothing, things like that can make a difference.
Right. Okay. So that's
And keep your fan.
keep your little fan in your purse and
keep your fan.
Okay. So is hormonal treatment a given during menopause? Is it like, okay, you're gonna have to have some type of hormones?
No, not at all. Again, it's individual. So some people are able to go through menopause and do just fine. Like I said, healthy diet, exercise also can ease that. Some people are able to take herbal supplements that help them just fine. I mean, there's things like they're called phytoestrogens. There are like black cohosh, wild yam roots, dong quai. Nowadays, especially when things started becoming problematic back in 2002, when the Women's Health Initiative study came out and women were just taken off of hormones right away, a lot more nutraceutical companies started developing products that had like maybe several different types of herbal supplements in them to and combine them so that it would they would all work together to really help with some of the symptoms. So there are lots of things that are out there, and if you go to a good health food store, you can generally, and do your research, you know, you can find different things that can help you. Not everyone is able to do well with herbals, okay, but many women are. They're able to take herbal formulas and have a diet that may have soy in their diet as well, and they're able to do well just with that. And again, even herbal supplements, you have to make sure that you check with your doctor. You need to make sure, especially if you're on any of the medications, that you be sure, because herbal does not mean no risk whatsoever.
Right. Okay, and can you tell us a little bit about natural hormones as well that can be used?
Okay, well, you know, we said that not all women need to be on hormones. Okay, so that's key. But my own personal philosophy, and I'm not saying that this is something that is ideal or this is the best or my feelings or what everyone should feel, but my feeling is that if you're going to restore or replace what's missing, to use things that your body is familiar with during the reproductive years, what it's naturally familiar with. So when you probably heard the term bioidentical hormones. So essentially what that means is hormones that's biologically identical, I should say, to the chemical structure of the hormones that your body had, you know, during the reproductive years before things were lost. So that includes, you know, estrogen, it includes progesterone, it includes testosterone, and some other hormones. So as a natural, meaning, you know, something that your body's familiar with, as opposed to synthetic or hormones that's not structurally identical to or similar to what your body's normally familiar with. So, yeah.
Okay, and so where do people get the natural hormones? Do they just get them like from a health food store or something?
Well,
or?
There actually is natural progesterone that can be actually obtained in a health food store. So, I mean, it's in a cream form, and there are certain brands that if you look on it and it has a certain dose and it says USP, then you know that they have manufactured it to in a way that it's measurable, you know, that you can get for a certain. So natural progesterone. There's some other ones too, but I tend to encourage people to go to a physician because it is hormones. It's not okay to just start using hormones and you don't know what your medical condition is or your family's condition is. You know, just because it says natural doesn't mean it's not hormones. It says natural hormones. It's still hormones. So the safest route is to see a physician that does prescribe, you know, natural hormones. And so, like I said, bioidentical hormones is one. And, you know, let them explain to you what the whole issue is with FDA approval and things like that, because, you know, the bioidentical hormones may not be FDA approved, but they're widely used in America for many decades. They're widely used in Europe. But it's just that it's not able to be manufactured in a way that, you know, a pharmaceutical company can say, okay, this is the dose, this is what I have, their name is on it, and then it can be tested and studied in order to get FDA approval.
Oh, I see.
So like the bioidenticals, they wind up, they're compounded or put together for you with a specific dose that your physician will have to, you know, prescribe for you. Okay? So there's natural or bioidentical, which we define that, and then compounded just means that it's mixed together or put together for you individually. It's not something that's in a bottle and then, you know, here you go with this dose or that dose. So what that does is it allows for a lot more fine-tuning with the dose, combinations of all of the different hormones together in a form that you can take it all together with, you know, changing different doses depending on what your needs are. There's also pellets, hormone pellets. Yeah, exactly. So estrogen or estradiol and testosterone pellets can be used, and it's actually a hormone. I know you're making expressions, but it's basically underneath the skin in the fatty tissue, and what that does is it gives you a long acting or slow release of those hormones. So you get a pellet insertion, and you can have it repeated every 3 to 4 to 5 months, depending on how long it lasts for you.
Interesting.
So, yes.
Okay. All right. Okay. So, what can men and other family members, what can they do to, you know, let's see, how can I say this? How can they be supportive to their wife, their girlfriend, their sister, the women in their lives that are going through something like this?
Menopause, Well, because of the fact that so many of the symptoms are symptoms that affect other people in our lives, it's important for those other people to understand. And again, the basis for understanding is knowledge. Have the information. Want to find out along with your, you know, wife or mother, whatever, what's going on. Desire to find out. Understand that no, you know, she's not just going crazy. No, what's wrong with her? You know, there's something that's going on, and sometimes people don't
understand that, okay, they're not doing this because they've gone loony, you know, or they're acting this way because they're just out of character. It is actually something that's physiological and that's going on in their body. So, and this is what's making these things manifest.
Right.
So understanding and having the knowledge and being supported, okay, and realizing that, okay, just the same way we know how to deal with conflict, right? We know how to deal with conflict. I mean, you know, well, we should know how to deal with conflict, okay? There's a time and a place for everything, okay? So if there's conflict, sometimes you need to back off, okay? Yeah. Let people have their space, have their room, you know, let things kind of ease up a little bit, you know, before discussing things. So sometimes women need their space.
Right.
You know, okay? They need to have their space. So, you know, the words that are said can either escalate a conflict or to calm a conflict. Right, okay. Same thing. You know, don't say, hey, what's wrong with you? You know, say, wow, okay, I understand that you're dealing, you're dealing with a little hot flash right now. Okay, you know, hey, here, you know, help them out. Give them a fan. Give them a cold, ice cold water or something. Put a cold towel around their neck, around their head. Something. Right. Be supportive, you know.
Right, be supportive.
And, you know, yes, it's freezing in the bedroom at night, okay? Put covers on to keep yourself warm, yeah. But, you know, so there's ways, again, understanding is key. And, you know, if you love that person, then you're going to understand. Right. You know, you're going to kind of understand, hey, things are happening, life is changing, and, hey, it may be changing for them too. You know, I mean, men go through their own personal changes as well. I mean, we all heard about midlife crisis and andropause and all of that stuff. So I think when the time comes, or if it comes, then, of course, the women need to be supportive as well. So it kind of goes both ways. So.
Okay, well, that's good guidelines to follow. Okay, Dr. Harris, we want to thank you for enlightening us on this. You know, we hear about menopause and things like that, but you know, just like you said, education is very important. Absolutely. Education is important. Absolutely. Thank you for joining us. We want to thank you for joining us as well, and we'll see you next time.